Hi, I'm Jaya Rajimathai, psychiatric nurse practitioner. As I mentioned in my previous video about autism spectrum disorder, today Mrs. Jenny Steve, she's a speech language pathologist, is going to explain about treatment options for the communication, the speech part of autism spectrum disorder. So let us listen from Mrs. Jenny Steve.
Hi, I'm Jenny and I'm a speech language pathologist. I work in the public schools. I'm also the owner and founder of Embrace Therapy Services, which is a pediatric speech and language private practice based in Illinois. So today I will share a little bit about what is autism and the crucial role that a speech language pathologist plays in the assessment, treatment, and advocacy of individuals with autism. So, what is autism? According to the National Institute of Mental Health, autism or autism spectrum disorder is a neurological and developmental disorder that impacts the way people communicate, interact with others, and experience the world around them. Although autism can be diagnosed at any age, it is considered as a developmental disorder because the symptoms generally appear within the first 2 years of life. Autism is also known as a spectrum disorder because there's a wide variation in the type and severity of the symptoms that the individual experiences. So it can range from mild to severe, and this depends on how much of these symptoms impact their everyday life. Now, all races, all genders, all ethnicity can be diagnosed with autism. Now, although autism is a lifelong condition, treatment and other services can actually help to improve an individual's symptoms and the daily functioning of life. What are the signs and symptoms of autism? Symptoms can be seen in very young children. However, sometimes these symptoms do not go noticed and they do not get identified until school age or even adulthood. In general, individuals with autism usually have symptoms in three main areas: 1, communication; 2, social skills; and 3, behaviors. So, what is communication? Communication is the process of exchanging information, thoughts, ideas, and feelings between two individuals. And this can be done through various means. It includes using your words, using signs, using gestures, symbols, body language, or even writing. But in general, communication includes understanding, speaking, reading, and writing. Now, a person with autism can show signs and symptoms in any of these aspects of communication. For example, a person with autism can have difficulty using gestures like pointing and waving. A person with autism can have difficulty understanding word meanings, difficulty following directions, difficulty using these words in sentences. They may also show reading challenges, difficulty with their writing skills, and difficulty maintaining conversations. Now, with respect to speech, sometimes a person with autism may speak very little or sometimes may not speak at all. A person with autism may also use robotic or sing-song manner of speech. Additionally, some people with autism tend to repeat words and phrases that they just heard recently or even days ago, and this is called as echolalia. And lastly, a person with autism can also use challenging behaviors because of their difficulty using words to communicate their wants and needs. So, what are social skills? Social skills are tools that enable people to interact and relate with other people around them. So a person with autism will have difficulty with their social skills. For example, a person with autism will have difficulty sharing attention with somebody, maintaining a topic, engaging in play, taking turns during a play, taking turns during conversation, sharing ideas with others, understanding others' feelings, or even difficulty with maintaining conversations, or even difficulty making friends and maintaining relationships. The third area is behaviors. A person with autism may repeat certain behaviors, including hand movements, body movements, crying, laughing, or become angry for unknown reasons. They may have trouble changing from one activity to another. They may get upset with certain sounds, smells, or textures. They may eat only few foods, or they may choose food based on the look and texture, and also show interest in only few objects or topics. Moving on to the assessment and treatment of autism spectrum disorders. Now, both the assessment and treatments typically involves a multidisciplinary team of professionals. Now, this includes a medical doctor, a neurologist, a developmental psychologist, a speech language pathologist, and an audiologist to rule out any hearing impairment. It is very critical to keep in mind that the individual and their family also play a very crucial role in being part of this team. So who is a speech language pathologist? A speech language pathologist, or an SLP, is a highly trained professional who specializes in communication disorders. As SLPs, we are trained to assess and treat a wide range of communication disorders, including those associated with autism. Now, our goal is to support individuals with autism in developing their communication skills and maximizing their potential for social interaction and participation in everyday activities. For the assessment, SLPs use a combination of standardized test materials, observations, and interviews to evaluate an individual's communication and social skills. Now, for individuals who have difficulty with their speech or have limited verbal output, the SLP assess their potential to use an augmentative and alternative communication system, or also known as AAC system, to help them communicate. Now, AAC can include sign language, gestures, pictures, computer tablets, or even other electronic devices. Lastly, while social communication challenges are common in autism, they are not exclusive for this condition. So in other words, not all people with social communication challenges have autism. So SLPs play a crucial role in differentially diagnosing or distinguishing between autism and other social communication disorder, thereby providing valuable insight into the individual's diagnosis and tailoring the interventions accordingly. Once the assessment is complete, the real work begins. Now, SLPs play an important role in autism treatment. They help to tailor the intervention program to meet the unique needs of each individual with autism. And this may include strategies to improve language development, build communication skills, and enhance social skills in different settings, including home, school, and work. Now, SLPs can also help a person learn how to use the AAC system if they need help communicating. Now, depending on the person's need, the SLP may work on different communication skills. For example, helping the individual get along with others in different settings, use a variety of communication support, learn to take turns in conversation, learn to move from one task to another, learn to expand their interest, including trying new foods, activities, and in schools, we also help with assisting with reading skills and writing skills. Additionally, SLPs also collaborate very closely with the families and caregivers and offer guidance and counseling on how to effectively engage with their child to promote language development and social interaction. Now, as the individuals with autism transition from childhood into adulthood, and as they navigate the complexities of a workplace, we SLPs continue to play a valuable role in facilitating with their integration into their professional environment. And this may involve like providing support in areas such as resume writing, interview preparations, and communication strategies tailored to their workplace context. Moreover, SOPs also advocate and empower individuals to advocate for their needs and collaborate with their employers to implement the appropriate accommodation that will facilitate success in the workplace for these individuals. Let's talk about the neurodivergent community. Now, the term autism is often used within the medical community to refer to the disorder or the disability. However, within the broader community, including medical professionals, school professionals, families, and advocates, there's a growing recognition of autism as a form of neurodiversity rather than just a disability. So, what does that mean? Neurodiversity is the idea that acknowledges neurological differences such as autism, ADHD, dyslexia, and others as natural variations of the human brain rather than considering them as a disorder or disability. So, this idea emphasizes the value of diverse ways of thinking, diverse ways of communicating, and diverse ways of processing information. It promotes acceptance and support for individuals with neurological differences and helping to advocate for their rights and autonomy. Again, for many individuals with autism and their families, acknowledging autism as a neurodiversity rather than a disability can be really empowering. It helps people to shift the focus from deficits to strength and help us celebrate the unique perspective and the unique ability that an individual with autism can bring to this world. As a school-based speech language pathologist, I've had the privilege of working with children with autism and have seen firsthand the transformative power of communication, of effective communication skills through speech and language therapy. And when I work with these families, I always make it a point to emphasize the importance of accommodating different ways of thinking, different ways of communicating, rather than trying to normalize or fit these children or these students into a neurotypical world. So, as we reflect on Autism Awareness Month, let us not only raise awareness, but also celebrate the remarkable progress made possible through the collaborative efforts of professionals, families, and individuals with autism. Together, we're building a world where every voice is heard, every story is valued, and every individual, regardless of their communication challenges, is embraced. Thank you.